Today is Rare Disease Day in the United States Congress and the House of Representatives. Many years ago, I would say almost 5 or 6 years ago, was approached by a young woman at a meeting I was doing at a medical facility in my district, who came to me to tell the story of her son, Cal. Cal Long, a former Cedar Park child, lost his life at the age of 5 years of age with an undiagnosed disease. I'm not sure everybody understands that there are people who get sick in this country with diseases that nobody seems to know exactly what that disease is. And it's such a frustrating situation, as this woman explained to me, to see your baby going downhill and ultimately dying from something that no doctor, no clinic, no hospital, and she went everywhere in Texas. And as you know, in Texas, we got great medical care, and she couldn't find the solution to that problem.
Hi, I'm Heather Long, and my son, Charles August Long, also known as Cal Long, passed away at the age of 5 in 2006 from an as yet undiagnosed disease. Every day, there are countless Americans, men, women, and children, and even men and women who serve our country in our armed forces, who are denied access to potentially life-saving treatments and cures because they lack the one prerequisite that would help them get what they need. And that one prerequisite is a diagnosis. While Cal was sick, one of my biggest issues that I had was that there was no network established for physicians who were handling undiagnosed cases. There was no one organization to which undiagnosed cases were reported, so virtually they didn't exist in our current healthcare system. Without a diagnosis, they didn't have an identity. My son didn't have an identity. So after Cal passed away, I came up with the concept of creating an undiagnosed physicians network that will facilitate the collaboration and research into these cases. And essentially, the Cal Network would allow a physician who is caring for an undiagnosed patient to register their case, search for other cases that are similar to theirs, and that find colleagues handling those similar cases so that they can reach out to each other and collaborate, if at a minimum, to improve the care and outcome, and hopefully a diagnosis. On average, it takes 7+ years for a patient with a rare disease to obtain a diagnosis. My son was sick for 3 years. He didn't have that kind of time. He's been gone since 2006, and I'm no closer to finding a diagnosis for him than I was back then. So that's why I'm so passionate about Rare Disease Day and just doing what I can to help these people get the care that they need.